the main takeaways that I've gotten just from any networking type talk I've listened to in the past is simply to put yourself out there.
Hi, welcome to the latest episode of the current Touro University, California's Alumni Podcast. I'm Glenn Faison. I'm up here in the Office of University Advancement on Wilderman Hall here on campus in Vallejo. Joining us today is Dr. Hugh Ngo. He's a dual PharmD MPH graduate from 2013. So an alum of two of the university's three colleges, the College of Pharmacy and also the College of Education and Health Sciences. Currently working in the Medical Affairs Department with Gilead Sciences Canada in Toronto as a Senior Medical Science Liaison in HIV. Did I get that correct?
All correct, Glenn.
Okay, great. So thank you for joining us, Dr. Ngo.
Thank you
it's
so
a pleasure
much.
to have you here.
Likewise.
So let's just jump right in. Why did you choose to attend Touro University, California? And kind of a follow-up to that, why did you go for the dual degree option?
Thanks for the question, Glenn. And again, just thank you for having me on your podcast. It's a great opportunity to be able to share my experiences at Touro and especially with current students and alumni. So hello to anyone that graduated in the same class. You might find it surprising just to hear from me. But to answer your first question, Glenn, why Touro, specifically the College of Pharmacy? And, I think when I was applying to pharmacy schools, I obviously looked at all of the programs in California. And I think what really stood out to me about Touro at that time was its 2+2 curricular design. So we're all familiar with that, but just for anyone who was unfamiliar, it's basically 2 years of didactic instruction, followed by 2 years of experiential instruction, so AK rotations. So that to me was a standout because that was the only program at that time offering that kind of curricular design. And so I felt the practical significance of that was being able to have more clinical experience, because that's what I felt was really important as part of my pharmacy training. The MPH was to me sort of a twofold objective. The first is, I think, to everyone's main objective these days, trying to navigate in our professional world, was job security. I knew with an actual credential, you just sort of increase your job opportunities. And what I liked about the Master's of Public Health degree specifically was actually very similar to why I chose the PharmD degree. And that's because when you look at both of these programs and what you can do afterwards upon graduation, you have so many options. And who doesn't love options, right?
Right.
So, and I'm sure we'll talk about this in terms of what's available to PharmD graduates these days. But just from the MPH alone, I mean, your potential job opportunities, they really run the spectrum. You can work in an administrative role once you're done. So, specifically in a public health setting, with the training that you get, especially if you have a strong epidemiology or biostatistics focus in your program, you can work in a research setting. You can definitely apply your MBH in the clinical settings, whether that's in a laboratory or clinic or hospital. And, the opportunities that you can also do in the community setting, whether it involves education, food, environmental safety, really the opportunities are quite endless. And I imagine even more bountiful when you consider the post-pandemic setting which we're in right now. So hopefully that answers the question. I think, in short, when someone asks me, why PharmD, why MPH, I would say if you're someone who loves options and you want a degree that is versatile, this is definitely something to strongly consider.
Oh, great. So I'm not sure if you're aware of this. The program here has switched over to a 3-year program.
Amazing.
This year's students, I think, are the first year that are doing the 3 years. So we've got a blending of students in the 2+2 and just some that are in the 3-year program. What's interesting about that is they figured out a way to capture darn near everything that was available. It's a pretty rigorous program.
It sounds like it
but
will
but
be. Yeah.
they've been able to capture a lot of the experiences that you had in the 2+2, taking it down to a pretty intense 3-year program. And they did that after surveying students. What do you want? What would you prefer? And it sounds like the answer was, we'll take a more intense program and try to finish it in 3 years. So it was a nice opportunity for the university to look at what it was doing, for the program to look at what it was doing, and based on feedback from students and prospective students, make the decision to switch over. And so far,
I'm glad it's going well, and I think certainly will make the program even more competitive, right? When you weigh all the different options in terms of pharmacy programs. So that's great to hear.
Yeah. So tell us briefly about your career arc since you graduated from Touro University, California.
Yeah. So the best way I can answer that is that I can say it started out what I thought to be a very traditional arc or pathway, meaning that when I finished my PharmD and MPH, I knew that I wanted to pursue additional clinical training through a residency program.
Okay.
So I ended up doing a PGY1 with the Veterans Administration, and we could spend a whole podcast just talking about how much I love the VA system and how progressive they are in terms of giving pharmacists such expanded scope of practice. And so if that weren't punishment enough, as soon as I finished my PGY1, I felt I wanted to further specialize as a clinical pharmacist. So that's when I decided to do a PGY2. And so my PGY2 was specifically in HIV pharmacotherapy. And I did all of this, even as I started pharmacy school, with the intent of entering academia upon finishing. And as you've sort of already saw yourself when you made the introduction to our audience here, that's not where I landed, because as soon as I finished my PGY2 training, that's when I started with Gilead Sciences as a medical science liaison. And that's where I've been over the past almost close to 9 years. Covering a wide variety of portfolios, but all very specific to virology. So I spent over half a decade in liver diseases, where the scope of work was primarily focused on hepatitis B and hepatitis C infection. And then the pandemic, that little bug, SARS-CoV-2 happened. And then I spent a little bit of time helping to educate clinicians about remdesivir. And very recently, I transitioned back to where my training started, which was in HIV. And there's a lot of really cool stuff happening right now in general in virology that just makes it a really exciting time to be working with, viruses, whether it's something that's been around for a while or some of the emerging viruses that you're hearing about in today's news.
So I love meeting with folks like yourself who are pharmacists, but are doing something other than, just kind of the layperson. When they think of a pharmacist, it's, yes. I got sick, I saw my doctor prescribed some medication, and I went to the pharmacy, and the pharmacist took care of me and explained to me, how I need to take this medication, proper dosing, whether I need to eat or drink beforehand or after, all of that. Or, if you're in a hospital setting and it's the person that's like getting your meds all set up for you while you're in a hospital setting, that's not you. There's a lot more opportunity to go beyond that kind of maybe as the novice, the traditional definition of a pharmacist. Why don't you talk about the different career pathways that are available for PharmD graduates and kind of describe them a little bit for our listeners who maybe haven't been through the program. They're maybe coming at this fresh and it's like, I'm thinking about being a pharmacist, but what is that and what can I do?
Yeah, thank you, Glenn, for the question. And you highlighted a point that I hope I made very clear earlier, which is the versatility of what you can do with your PharmD once you're done. So the sort of funny and beautiful thing I would have to say about my current role, and I'll touch upon that in a bit, is just, the more non-traditional it gets, the more difficult it is to almost sometimes summarize your day-to-day to someone who is not quite as familiar. But hopefully I have an opportunity to do it justice. But to answer your question, you wanted to understand when there are career pathways for pharmacists, nowadays, like what does that sort of look like? And you highlighted the community pharmacist. I think this is the primary image of pharmacists that a lot of laypersons have in mind when they hear that. But I think what really amazes me about the pharmacy profession is, just where your PharmD could take you. So a lot of our listeners, I think, will be very well versed and will recognize the value of pharmacists in very specific clinical direct patient care settings. And so this is another type of a pharmacist. Your clinical pharmacists, they work in hospitals, ambulatory care settings, emergency departments, community health centers, rehabs, and in this particular capacity, they work really collaboratively with a team, often multidisciplinary care. And I think it's a great opportunity for pharmacists to show their impact. And here's where I've seen, pharmacists make direct clinical interventions and tremendous impact for the outcomes, the health outcomes for any patient that they see. Sort of a subset of these types of pharmacists, you may also think of the long-term care pharmacists who work in like nursing homes or rehab facilities. And in this particular setting, they work to, again, provide similar treatment services, but to a very specific subpopulation of patients. And this is where I think pharmacists who have a particular interest in geriatric pharmacotherapy will definitely find it very rewarding. In the community setting, I think you've also heard about infusion and compounding pharmacists. I think they provide an invaluable service. I mean, I can think of some really memorable stories during my rotations where, if a medication was only available in a tablet form and have to be made into a liquid solution, these are the pharmacists that you call upon, right, to meet the specific needs of that patient. So these are the traditional kind of pathways if you're looking at how to really apply that pharmacy in the sort of textbook fashion that you sort of learned in school. I took what would be considered a non-traditional career pathway, and that is I'm someone who has a PharmD but works in the pharmaceutical industry. So my role specifically is in medical affairs. I don't even know if we have time to just go through my day-to-day, but what I can tell you just as a general statement is that in the pharmaceutical industry, the individual roles of pharmacists will vary. And I think this, for some people, will find it really exciting and attractive because in a given company, you have pharmacists, especially I can say this for my own company, they can work in a variety of different settings, regulatory affairs, pharmacovigilance, which deals primarily with drug safety. They could also work in clinical research or even something you would never even think about, which is like sales and marketing. So I think the opportunities are quite plentiful if you're someone who's interested in pursuing a career as a PharmD in this industry, the one that I'm in. Hopefully that gives you a flavor of what's out there. I think I've just scratched the surface, right?
Yeah, and
public health, government, like
right.
The list goes on and on.
Right, and there's also the academic setting. Somebody has to teach the next generation of pharmacists.
I think I forgot to mention just because I feel like I betrayed my own pathway. But yes, absolutely, your academic pharmacists who just do a juggling act all day between teaching, service, and research.
Yeah. So professional development is important across all kinds of professions and industries, but it's particularly important in any kind of medical field to include, the pharmacy profession. So what advice can you offer to help PharmD grads, build that successful career in pharmacy?
Gosh, how much time do we have, Glenn?
As much time as you need.
Yeah, this is like a whole symposium. You want to talk about
commercial-free programming here.
This is a topic that I think is so essential in any industry, right? And so the question as it relates specifically to pharmacy, I think it borrows from a lot of similar advice. And I'll do a quick shout out because there was a really great article written in the Pharmacy Times, I think back in 2020 by, believe it or not, one of a Touro faculty by the name of Shane DeSalle.
Okay.
And he penned an article for the Pharmacy Times, entitled "Continuous Growth as a Pharmacist and a Person." And I just remember reading a lot of some of the main takeaways from his article, and you can really apply this across many professions, clinical or otherwise. But some of the things that I remember in terms of really big and useful and practical piece of advice are as follows. I would say the first, and this is particularly true in my role, is we're all trained to be very good at understanding data, and I'm just thinking about my DO and PharmD and MD and nursing colleagues here. Sometimes, however, in school we don't have the same opportunity to work on our soft skills. And those, believe it or not, are equally important when you are in the working environment, because employers are evaluating you based on what they think are your strengths. So this is inclusive of how you're able to communicate, the value of a study, as well as your ability to talk to your colleagues and to your patients. So when I say soft skills, I'm talking about stuff that you're probably not going to learn in school, but are really going to save you a lot of headaches and will help actually advance your career if you do it really well. So this is about developing relationships, how to talk to people. And I don't mean how to present data, right, or counsel. I mean how to develop an opportunity or how to develop rapport with them. That's difficult to do and takes a little bit of time and effort. And I think these days, if you are someone who sees a problem and knows how to solve problems through very difficult scenarios, that's another soft skill that is going to carry you very, very far. Beyond that, I think Shane does a really nice job of also highlighting things like, staying abreast of news in your field, right? If this is the field that you decide that you really love so much, on top of just keeping on top of the pure lit review, you're just going to have to also understand your industry, right? You have to understand the issues that affect your practice. You have to understand, how this is going to affect your overall career directory. And thankfully, I think with a lot of the online resources that are available these days, obviously social media, we have an opportunity to just kind of learn a little bit every day to stay on top of those news. And I think the final piece is probably one that you just have to embrace just more internally. And Shane does a nice job of just sort of saying you have to develop this kind of growth mindset. And so the idea here, the essence, as I understand it, is he says it's really important to seek feedback, not for the sake of seeking feedback, but for the intention that you're going to leverage into something positive, right? Like, and so put it to good use, in other words. And this feedback can come from anyone, your coworkers, but also like your friends, family members, all with the intent of building your self-awareness so that you have an opportunity to reflect. And when you learn things about yourself from the people around you, ultimately that will hopefully make you a better person and ultimately a better pharmacist and an overall professional. So I don't know if I did that article justice, but those are just some of my main takeaways, and I felt to be really practical and still highly topical right now as I do my own day job.
Well, I think that was great. I mean, it's stuff that, like you said, it can apply to any career path that you're on, really, any profession that you're in, really anything that you care deeply about, even if you're not doing it as a job or a career. So tell us a little bit about your experience with mentoring, both as a mentor and a mentee, and what are your thoughts about the importance of mentorship, specifically in the pharmacy profession?
Yeah. Thank you, Glenn. This, I think, is something when I was a student, I wouldn't say there were specific mentoring programs available. That might have changed, and please let me know if there are new programs on this. But I think a lot of mentoring just sort of happened organically and informally. And I would say to anyone who's sort of in the same box where there's no formal programs, to just think about your entire network as potential sources of mentoring. For me personally, I was really lucky to have like teachers. I mean, just throughout my entire years of schooling, not just in pharmacy school, but I just have a profound respect for teachers. And so in them, I naturally found a source of mentorship. And this was for anything related to academic type questions or even non-academic type questions. You just have to find someone that you feel comfortable and that you really admire and want to follow their career path. And ask them for advice and just be really open to the feedback that they give you. As a mentor myself these days, I do that in two sort of capacities. One, as a co-lead for a residency program that I actually started with Gilead Sciences.
Okay.
And I did that because when I was graduating and looking at alternative career pathways for PharmD graduates, like there wasn't a whole lot of opportunities, right? Like industry fellowships were extremely competitive, and it's really difficult to sort of get in the door. So me co-leading this program and creating it at my affiliate right now in Canada was an opportunity for me to just give a lot of PharmD grads an opportunity to also get in the door. And I feel like it's really important to pay it back and pay it forward, especially recognize that the opportunities are so limited. But unofficially, I've also said to Touro, if you have people who are interested in just having a chat with someone in the industry, like I'm available. And I feel like it's really important to be able to share your learnings because, I think this is just how people find out about opportunities through word of mouth sometimes. And so if I can give someone the opportunity to learn more about what I do and give them an opportunity to get started in the industry, I'm more than happy to be that person. I hope that answers the question.
Oh, yeah, certainly. Why don't you describe for us the role of pharmacists in patient care? I know there's patient education, advocacy, promoting public health. Why don't you talk a little bit about that, the pharmacist's role?
Yeah, so in my current role now, I can sort of just comment personally. I'm completely removed from the direct patient care aspects. That being said, in any given day, I'm consulted on a complex patient case, and the physician, nurse, or pharmacist that I work with will often ask me, do you have any specific data in relation to this clinical scenario? And this is where I feel like, even though I'm completely removed from that sort of patient journey, I still can make an impact on the outcomes as it relates to that patient. But if we're going to think about this question more broadly, pharmacists and their role in patient care, I mean, there's an example that's very close to home for me, and that is, if you just think about the role of an HIV pharmacist these days, right? Very specialized, work in these outpatient clinics. They just do so much for patients. They help patients who are struggling with access to antiretroviral therapy. They help them navigate high costs of treatments. They help them work around barriers to adherence. And this is both medication related and more psychosocial issues like homelessness or comorbid mental health challenges. So I think just in that alone, like you have an opportunity for pharmacists to not only provide education, but be huge advocates for the clients that they serve. And, when I think more broadly about the role of pharmacists and just putting my public health hat on, I think one of the really cool things that I've seen pharmacists do over the past, just 5-10 years is get more involved in prevention, right? And so because we often think medication, it's often more in the sort of secondary to tertiary level of prevention. But pharmacists, I feel like they have great opportunities these days to really get involved in providing primary education, whether that's counseling about cardiovascular health, lipids, things like that. But, I'm going to borrow an example from home again, just because it's just something top of mind for me. You may have heard about prevention of HIV through PrEP. And so another way that I've seen pharmacists really play an important role here is by being providers. There's these PrEP clinics that pharmacists do, providers of HIV PrEP. And these are medicines that are taken prior to exposure to prevent transmission. And unfortunately, right now, there's only a handful of states that do this, that give pharmacists the authority to prescribe PrEP. But when you look at the research that's sort of been published, it clearly shows that in those jurisdictions where you have expanded pharmacists prescribing authority, there's an uptick in the number of filled prescriptions for PrEP. And this, I think, is great evidence to show that pharmacists can play a really important role, right? Not only in just getting the medications people need, but making a really big dent on an epidemic and in terms of increasing their role in prevention services.
That's true. Yeah, definitely all true. So you've touched on research a couple of times now. So tell us about some of the more significant research developments in pharmacy. And kind of a follow-on to that, what role do pharmacists play in the field of pharmacological research, just kind of broadly?
Yeah, I mean, if I were to just borrow from my own experience as an MSL in the industry, on any given day, I mean, I feel like I am sort of participating in some kind of research activity, whether I'm discussing research with our, international thought leaders, in the field. We also attend a lot of medical conferences, so naturally we're involved in discussing insights and what are practice implications from research. But MSLs, I mean, depending on which company you're at, they're also quite involved in supporting like the development of medical publications and also investigator-led research. And they help with things like study design and stuff like that. But to answer your question, just what are the opportunities for pharmacists if someone is interested in this? Well, again, you'll be happy to know the opportunities are quite varied and bountiful. I think pharmacy research is number one, cool, but two, this broad field that's growing right now, and it really spans a really wide range of topics, and that can include, something as like drug discovery, development, so it's sort of like early phase clinical trials, to clinical pharmacy and health services. So when I think about where pharmacists have played an important role in each of these aspects, like I can tell you, I've met pharmacists who work in the development and testing of new drugs and therapies. We have pharmacists who do that in my company. I've also met pharmacists in the clinical setting who their research is focused on the use of medications in patients, right? And they often will conduct clinical research and lead clinical research to evaluate things like safety, efficacy, cost effectiveness of medications, and even new strategies and innovative ways to manage patients with medications. And then you have pharmacists who are more involved in just looking at the bigger picture. So these pharmacists, I think, are more involved in things like health services research. So they'll look at organization, delivery, financing of healthcare services. They'll conduct research to evaluate, the impact of pharmacy services on patient outcomes. And you can find this sort of happening at the HMO level, like Kaiser, or even at the governmental level. So I think the opportunities of pharmacy researchers, just to sort of recap this, is really expanding and quite diverse. If this is a field that people are interested in, this exists in both academia as well as industry. If you decide to do this in universities, hospitals, or pharmaceutical companies, I'm sure there won't be, just you'll find that the opportunities are there if you have the right skill set.
Great. Why don't you discuss the qualities of a good leader in the field of pharmacy and how leadership skills are developed within the field? I think you've touched on some of this with a couple of the other questions.
Yeah, and this is a tough question, I think, in general, because there's sort of no one way to be a leader, and I think we oftentimes have to think about the difference between holding a leadership position and actually demonstrating leadership qualities, right? Because they're
Right.
not always the same thing. And there's a quote, I don't remember who said it, but I heard it once, and I just thought it was sort of stuck with me because I was trying to define leadership, and I'm like, how does one define leadership, right? I mean, you can just go 20 pages on this, but one of the ways that you can do it is and I reflect on this quote, is they say the true measure of leadership is influence. And I don't mean trying to get people to like do things, but influence in the sense of inspiring people, right? To
Right.
do something differently. And so what does that mean? Well, I think when I think a lot about who I sort of admire and look up to and are inspired by the leaders that I work with in my field, one quality that really stands out to me is the leader is someone who understands and takes time to sort of ask their team, right? Like, is everything going all right? If it's not going all right, like, what can we do better, right? And that's not always someone in a managerial position. And a good leader also understands how to nurture strengths and help identify opportunities for improvement. That's someone who says, you know what, I saw this. I think this would be great for you, or I think you would be great at doing this. How about you take this on? That's one example. I think a good leader also is someone who recognizes the accomplishments of others, right? It's not all about maybe tooting their own horn, because
Right.
sometimes you may feel like, he's kind of all about hearing about himself. But the good leaders to me are the ones who says, you know what, she did a fantastic job, and I just want to make just take a pause and recognize the contributions that she made. I think a good leader, and this is going back to my comment around soft skills, is someone who, I think oftentimes will sort of hold back the complaint, even though they're complaining just like the rest of us, but they're the ones who will say, you know what, I'm not sure if that's the best thing, right? The best sort of strategy or the best way to do this. How about we try this, right? And that is someone who understands that we're more productive when we're solution focused. And that's a hard thing to do, because your immediate impulse, I think, as a human being, is just like, I don't like that. That bugs me. That drives me, you know what?
Right.
And that leader is someone who sort of like almost kinds of fights that impulse, or just sort of keeps it to themselves, and instead asks the question, how can we do that a little bit better? Like, how can we try something new so that we can sort of get at a different outcome? And so those are just some of the things that sort of come to my mind. And maybe the last thing I'll say is, I particularly admire leaders who hold themselves accountable. Because I think, and this is very difficult for myself, because we all want to succeed. We all want to demonstrate the value that we bring to our work, and we all want to just show the impact that we make, right? As someone who shows up and tries to do the work to the best of their ability. And sometimes I think the people who sort of put themselves out on the ledge there and say, you know what, that didn't go so well, and I
Yeah.
own it. And I'm sorry that, like that happened, or just saying that wasn't the outcome we expected, but let's try and learn from this.
Right.
And are humbled enough to sort of take that on. Man, to me, that is leadership material. So those are the kinds of the qualities that I'll probably be working on for the rest of my life. Because I think we can all just sort of be leaders in our own right, regardless of the position that we occupy. We all have a tremendous opportunity to not only just impact the health of our community, but also our microenvironment, right? Our coworkers, our immediate to sort of auxiliary
Right.
teams that we work with. And leadership, I think these days, need to occur more at those levels, as opposed to just those very high top senior levels.
It's not the title, it's the action.
100%. Well said, Glenn. And with that, I'll step off my soapbox.
So what advice can you offer to effectively network and build lasting professional relationships in the pharmacy industry? And this is kind of where we're going to wrap things up here.
Oh boy. I struggled with this question a lot as a new grad when people were asking me, because I don't know why this surprises a lot of people, but I'm actually very introverted by nature. So
really?
Yes, I know. I do great on one-on-ones though. As you can see, I'm like nonstop. So I think the lesson that I've learned and would like to just make sure everyone remembers is that, networking doesn't have to mean you have to be a social butterfly. Like, you don't have to go out there and talk to everybody and shake everybody's hands. That's not what I've come to appreciate about networking. Networking is intelligent and it is continuous. What do I mean by intelligent? You have to be almost methodical, strategic, intentional about it. You have to know, like, what are my objectives for doing this? And once you identify like that there's an opportunity to network with someone, you have to understand how to nurture that relationship, because it's not sometimes it's a one-time thing, but in general, it's nice to just kind of get develop a relationship with people in general. And that's hard for people like myself who, like I said, are a little bit more introverted by nature. But I think the main takeaways that I've gotten just from any networking type talk I've listened to in the past is simply to put yourself out there, right? It's about finding that mentor. It's about finding colleagues who are in a position that you want to maybe try out for yourself, and just having a very candid conversation and reflecting with them. And this could happen at a formal sort of meeting. It could happen at the lunchroom. I don't think there's a setting time, place for networking. Networking is more of a mentality. And that's why I said earlier, it's something you have to just commit to doing and commit to doing intelligently. So, and I say all of this is because when we're thinking about networking, it's often in the context of professional development, right? Like that's the reason why any of us sort of do this. I think the big takeaway is that you network because you just don't really know where that next big break will come from. And I've seen it come from people just working their you-know-what off and climbing that ladder, right? But sometimes it happens because you got a call from a recruiter because you have a solid resume on LinkedIn. It could be a random person on an elevator or someone who sits next to you on a plane. I've seen that happen as well. I got my position, believe it or not, because I was giving a talk at a Grand Rounds in my PGY2. And that MSL I came across upon later at a research conference. And so we got to talking. And when he saw an opportunity that he thought would be great for me, he remembered me. Right? So this is the stuff sometimes careers are made of. It's sometimes random, sometimes very deliberate and well thought out. But I think the big point is that when you come in contact with people, be open-minded, be friendly, get to know them, because you never know, how many people might be surprised to actually want to connect with you as well. And you also never quite know what opportunities will lie ahead, and where they might come from or from whom they might come. So that's maybe the one, I don't know how sage the advice is, but that's what I've just learned to come to appreciate in my own role.
No, that's wonderful. Thanks for distilling that like that. That's, it's right on point, really, when you think about it. Making connections with people, and they have to be genuine. You have to be who you are, your genuine self, and be able to share your knowledge and your passion in a way that resonates with others.
Yeah, you have to put your genuine self out there. You have to be genuine about your intentions, and you have to be genuine about receiving the feedback when you're asking for it. I think that's sort of the vibe that I get when someone is talking to me about networking these days.
Well, I think that's about it. We probably need to wrap this up here. So I want to thank you for taking such a big chunk out of your day and joining us.
Thank you,
And
Glenn.
no, it's been a pleasure, and I want to thank our audience as well for taking the time to listen. Until next time, everyone, take care.
Yes, thank you, audience. Hopefully, you got some useful out of there, and I think maybe my contact will be shared at some point. So please reach out if I could help you with your own professional development in any way. Thank you so much.
Great. Take care, everyone.